As you plan for retirement, you'll need to make several important decisions about your Medicare coverage, even if you'll have other coverages available to you. For instance, through an employer group plan, you'll still need to make some very significant Medicare enrollment decisions before you stop working. Hi, I'm Cullen Teska of Senior Market Solutions, your Medigap insurance advisors. Take a second to subscribe to the SMS YouTube channel. We're always working hard to create new educational content. Almost every day, people call us for help choosing between Medicare and employer group coverage. Here are 4 key steps we recommend to guide your decision making. Number 1, confirm you're eligible for Medicare. Number 2, decide whether you should enroll in Medicare Parts A and B. Number 3, figure out if you need additional coverage like a Medicare supplement insurance policy or a Medicare Advantage plan. And finally, number 4, determine whether you need Medicare prescription drug coverage. Whether you're an individual or part of a couple, choosing between Medicare and employer group coverage can be tricky. Stay with me as I walk through these 4 key steps. I'll also provide some real-life scenarios to help you understand your own coverage options. So let's start with Medicare eligibility. Generally, in order to receive Medicare coverage, you must be at least 65 years old, you must be a U.S. citizen or a permanent resident who has lived in the U.S. for the last 5 years, and you must have paid or be married to someone who has paid at least 10 years worth of Medicare taxes. People under 65, disabled individuals, and others with certain qualifying medical conditions may also be eligible for Medicare coverage. After confirming your eligibility, consider whether to enroll in Medicare Parts A and B, also known as Original Medicare. For individuals 65 and up, the answer will depend on the size of your employer. If you work for an employer with fewer than 20 employees, you must sign up for Part A and Part B. Once you turn 65, your employer becomes the secondary payer and no longer has to pay for anything that would be covered by Medicare. On the other hand, if you work for an employer with 20 or more employees, signing up for Part A and B is optional. After enrolling in Parts A and B, Original Medicare acts as your primary hospital and doctor insurance. The next consideration is additional coverage. Medicare doesn't cover all of your healthcare costs, only about 80%. You, the beneficiary, are responsible for the other 20%. You'll need to decide whether you need supplemental insurance to minimize out-of-pocket expenses. You can choose to pay the 20% out of pocket, or you can purchase additional coverage to help bridge the gap. The 2 types of health insurance that cover hospital and doctor services are Medicare Supplement Insurance, often called Medigap, and Medicare Advantage, also known as Part C. You might be asking, what is Medigap? A Medigap policy is supplemental health insurance that helps pay for some of the costs that Medicare doesn't cover, like co-payments and deductibles. Medigap policies are sold by private insurance companies, and they give you the freedom to choose your own hospitals and doctors. Once insured, you can never be dropped due to health reasons. Now you might be asking, what is Medicare Advantage? Medicare Advantage is considered an alternative to Original Medicare. It includes HMOs, PPOs, and private fee-for-service plans. Companies receive a fixed amount from the government for your participation, enabling them to offer plan members a low or even $0 monthly premium. In exchange, Advantage policyholders are subject to numerous out-of-pocket expenses in the form of co-payments and deductibles. Companies can also establish their own rules for service, such as the needs for referrals and restrictive provider networks for both non-urgent care and emergency services. The final piece of the puzzle is deciding whether you need Medicare prescription drug coverage, otherwise known as Part D. Medicare Parts A and B don't cover outpatient prescription drugs. Your decision to purchase or forego supplemental insurance will determine whether a Medicare prescription drug plan may be necessary. You'll probably need to purchase a standalone Part D plan if you enroll in a Medicare supplement or you decide to stick with Original Medicare to cover your healthcare costs. You probably won't need a Part D plan if you enroll in Medicare Advantage, since most Advantage plans include prescription drug coverage. If you'd like to learn more, I encourage you to watch some of our other content. In this video's description, you'll find links to related videos and playlists on topics like Medicare and Medigap Explained, Medicare Advantage, and Part D. Now, let's examine some common scenarios. For these examples, we're borrowing the names of some of our recent YouTube subscribers. Let's get started. When either an individual or spouses enroll in Medicare Parts A and B at the same time, there are a couple of common scenarios that we run into. Since Medicare doesn't cover all of your healthcare expenses, you should consider whether you need additional coverage for what Medicare doesn't cover. Many people with Medicare choose to purchase either a Medicare supplement insurance policy or a Medicare Advantage plan. So here's scenario 1. Maria is an individual who's about to retire when she turns 65. Maria is eligible for Medicare. She enrolls in Parts A and B when she turns 65. And Original Medicare becomes her primary hospital and doctor insurance. Medicare will cover about 80% of her healthcare costs, leaving her responsible for the other 20%. Next, Maria will need to decide whether she needs to purchase additional coverage, either a Medigap policy or a Medicare Advantage plan. If Maria purchases a Medicare supplement policy, she'll need to decide whether she also needs Part D prescription drug coverage. If Maria purchases an Advantage plan, she probably won't need a standalone Part D plan because most Advantage plans include prescription drug coverage. Here's scenario 2. Karen and Michael are a married couple who plan on retiring when they both turn 65 next month. Both are eligible for Medicare. Karen and Michael both enroll in Parts A and B at the same time when they turn 65. Original Medicare becomes their primary hospital and doctor insurance. Medicare will cover about 80% of their healthcare costs, leaving them responsible for the other 20%. Next, Karen and Michael will need to decide whether to purchase additional coverage, either Medigap policies or Medicare Advantage plans. If they purchase Medicare supplements, they'll need to decide whether they also need Part D prescription drug coverage. If they've purchased Advantage plans, they probably won't need Part D plans since prescription drug coverage is included in most Advantage plans. The situation changes when one spouse isn't eligible for Medicare or when spouses aren't enrolling in Parts A and B at the same time. The employer size matters, so the next scenarios illustrate paths forward for those working for small and large employers. So let's say you or your spouse enroll in Parts A and B. In this situation, Medicare is considered the primary health insurance. If a spouse chooses not to enroll in Parts A and B, then the employer group insurance will not pay for anything that Medicare would have covered. So here's scenario number 3. James and Cherry are a married couple. They currently have group health insurance through Cherry's employer. Cherry works for an employer with fewer than 20 employees. James is retiring when he turns 65 and he's eligible for Medicare. Cherry is only 60, so she's not eligible yet. Her own coverage won't change. If James chooses not to enroll in Parts A and B when he turns 65, Medicare won't cover any of his healthcare costs. Cherry's employer group insurance won't pay for anything that Medicare would have covered. However, if James chooses to enroll in Parts A and B when he turns 65, Medicare will be considered his primary health insurance. Medicare will cover about 80% of his healthcare costs. If James chooses to keep it, Cherry's employer group insurance will be considered his secondary health insurance. However, if James decides to leave Cherry's employer group insurance, he'll need to decide whether to purchase additional coverage, either a Medigap policy or Medicare Advantage plan. If James purchases a Medicare supplement, he'll need to decide whether he also needs Part D prescription drug coverage. If James purchases an Advantage plan, he probably won't need a Part D plan. since prescription drug coverage is included in most Advantage plans. Now, if you'll have health coverage through a spouse who is still working, you'll retain that coverage under his or her employer plan. You may be able to delay your enrollment into Parts A and B based on your desire to stay on the employer-provided coverage. So here's scenario number 4. Joseph and Mira are a married couple. They currently have group health insurance through Mira's employer. Mira works for an employer with 20 or more employees. Joseph is retiring when he turns 65 and he's eligible for Medicare. Mira is only 59, so she's not eligible yet. Her own coverage won't change. If Joseph chooses not to enroll in Parts A and B when he turns 65, Mira's employer group insurance will remain his primary health insurance, so Joseph's coverage won't change. However, if Joseph chooses to enroll in Parts A and B when he turns 65, Medicare will be considered his primary health insurance. Medicare will cover about 80% of his healthcare costs. If Joseph chooses to keep it, Mira's employer group insurance will be considered his secondary health insurance. However, if Joseph decides to leave Mira's employer group insurance, he'll need to decide whether to purchase additional coverage. So again, either a Medigap policy or an Advantage plan. If Joseph purchases a Medicare supplement, he'll need to decide whether he also needs Part D prescription drug coverage. If Joseph purchases an Advantage plan, he probably won't need a Part D plan again because prescription drug coverage is often included in most Advantage plans. Lastly, let's talk about people with no insurance coverage or those acting as self-insured. Yes, folks, this does happen. If you won't have health coverage from a current or former employer, you should enroll in both Part A and Part B. After enrollment, you may purchase either a Medicare supplement insurance policy, also known as a Medigap policy, or a Medicare Advantage plan. Medicare doesn't cover prescription drugs either, so you'll also need to determine if you need to purchase a prescription drug plan, also known as Medicare Part D. So here's scenario number 5. Julianne is an individual who's about to turn 65. Julianne is eligible for Medicare. She doesn't have health coverage from any current or former employer, and Julianne enrolls in Parts A and B when she turns 65. Original Medicare becomes her primary hospital and doctor insurance. Medicare will cover about 80% of her healthcare costs, leaving her responsible for the other 20%. Next, Julianne will need to decide whether she needs to purchase additional coverage, either a Medigap policy or a Medicare Advantage plan. If Julianne purchases a Medicare supplement policy, she'll need to decide whether she also needs Part D prescription drug coverage. If Julianne purchases an Advantage plan, she probably won't need a standalone Part D plan because most Advantage plans include prescription drug coverage. So here's scenario number 6. Salvatore and Barbara are a married couple who will both turn 65 next month. Both are eligible for Medicare and neither has health coverage from any current or former employers. Salvatore and Barbara both enroll in Parts A and B when they turn 65. Original Medicare becomes their primary hospital and doctor insurance. Medicare will cover about 80% of their healthcare costs, leaving them responsible for the other 20%. Next, Salvatore and Barbara will need to decide whether to purchase additional coverage, either a Medigap policy or Advantage plans. If they purchase Medicare supplements, they'll need to decide whether they also need Part D prescription coverage. If they purchase Advantage plans, they won't need Part D plans again since prescription drug coverage is included in most Advantage plans. Hopefully these scenarios give you a better understanding of the Medicare versus employer group insurance decision tree. Enrolling in one or both parts of Medicare and staying or not staying on you or your spouse's employer group plan are big decisions with even bigger consequences to your retirement plans if not planned and executed carefully. For most people in the situations discussed, it comes down to cost effectiveness and marital situation. how much your employer coverage costs you each month, your deductible, co-pays, and medication costs, and whether or not you have a spouse who will need to obtain or continue coverage. The team and I here at Senior Market Solutions can help you decide if you should enroll in Part A and Part B now or later, and we can walk you through enrolling in supplemental coverage you may need after we evaluate your unique situation. Just call us toll-free at 1-855-784-9649 or click the link in the description to book your appointment online. Hey there, did you know you can search YouTube by clicking on the hashtag? It's an easy way to find videos about specific topics. A full hashtag list appears in the description, but you'll see 3 hashtags below. Try a hashtag search now in 3 easy steps. First, click on hashtag Medicare Advantage. Second, scroll through the YouTube search results to find the next video by Best Medicare Solutions for Seniors. Third, click to watch.